medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Welcome to part 2 about photobiomodulation, infrared therapy actually. A PBM, as we know it, is actually a low-level monochromic or quasi-monochromic light that goes from the visible blue to the far infrared, about 3,200 nanometers, to induce a non-thermal photochemical and photophysical effect. PBM therapy can stimulate or inhibit, basically modulate, physiological activities depending upon the signal-to-noise ratio and the tissues that we're trying to get and the parameters that we're using. And these characteristics determine what the biological outcome will be and whether it will be positive within this set of parameters. In other words, what kind of machine, how good is the irradiance? We talked in part 1 how close we are to the machine to create joules. Now, the mechanisms of PBM at the tissue or cellular or even molecular level are somewhat of the following. Cytochrome C oxidase, which is partially responsible for light energy and transfer to cells and tissues, and also nitric oxide, which is activated and plays a modulating role in oxygen-dependent pathways of cytochrome C oxidase as well. The other is the oxygen-independent pathways that are also vital because of water. Water is stimulated by light. We're 90% water, and the infrared gets into the water and changes that water, so it is transporting and changing biological surfaces. And it does get into the tissue levels and eventually will actually increase adenosine triphosphate production. That's what it's all about, mitochondrial enhancement. Well, PBM has also been very good in certain diseases like diabetic neuropathy, macular degeneration, glaucoma, Alzheimer's, Parkinson's, and even though these neurologic diseases have different etiologies, different pathophysiologies, etc., there is some cell signaling that basically may be similar to them, which includes programmed self-death, this oxidative stress that they all cause, and the activation of apoptotic pathways and inflammatory responses. They're all common throughout these. Now, of course, PBM can modulate apoptosis, and it can modulate necrosis as well. It can be pro-oxidative in the short term, in the beginning, but antioxidative as it starts to stimulate other areas, and therefore it modulates reactive oxygen species. It can help in stress and inflammatory type of reactions, even in the brain, including the reduction of amyloid beta. Now, there's evidence also that the protein misfolding or this protein changes and misfolding that we see in so many diseases, especially as we age, are the root of a lot of diseases like cataract, Alzheimer's, Parkinson's, Huntington's, etc. And they found that supplementation with photobiomodulation can actually control the levels of protein folding and unfolding properly.